There's so much that's happening at ASCO GI this year. It's always hard to know exactly, what to focus on. I think the oral abstract sessions this year are really outstanding. I think that there are a handful of areas that I'm interested in. For colorectal cancer, I think we're going to see updated data on ctDNA. So this is circulating tumor DNA and the impact of ctDNA in early stage colorectal cancer. And I think the question that people really want to answer is, can we utilize something like ctDNA to guide therapy for colorectal cancer? So there'll be two big abstracts that are going to be presented at GI ASCO. One is a stage 2 study looking at the use of ctDNA for low risk stage 2 colon cancer. And that's the COBRA study, and that will be presented at the conference. And in the stage 3 setting, we're going to get updated data on ctDNA and what we call ctDNA kinetics. What does ctDNA do over the course of treatment or even observation? And this is going to come from the Japanese Galaxy study. They presented at multiple conferences before, but this will be updated data. And I think as we get more data in this space, it'll be very helpful. For
Nice.
neuroendocrine tumors, there's going to be updated abstract on the efficacy of what we call PRRT, or peptide radionuclide radiation therapy for grade 2 and grade 3 neuroendocrine tumors. We have a lot of data in grade 1 and some grade 2 neuroendocrine tumors, but I think seeing that data in higher grade neuroendocrine tumors that are still well differentiated, I think will be really helpful to know if this is a viable treatment option for higher grade, well differentiated neuroendocrine tumors. And then finally, when we think about hepatocellular carcinoma, there's been a lot of excitement with immunotherapy. The Emerald-1 study is going to look at transarterial chemoembolization, or TACE, with durvalumab, which is an immunotherapy. And this is a study that was done with or without bevacizumab for patients with unresectable hepatocellular carcinoma. And so I think that this will be a really interesting abstract. This is a really, really large study. And it'll be interesting to see, well, what is the impact of immune therapy and anti-VEGF therapy for our patients who are unable to receive surgery for hepatocellular carcinoma? I think that this is really, these are what I described were some of the abstracts that we're really looking forward to. Now, the question is, will these abstracts change the way we practice medicine in these particular diseases? And I think it really just it remains to be seen. And I think that that's why they kind of embargoed the results of these abstracts until we're actually there on the day of the presentation, because if the results of the studies are negative, that's still extraordinarily helpful information. But obviously, if some of these studies are positive, they can really lead to changing the way we treat, say, hepatocellular carcinoma. When we talked about the Emerald-1 study with TACE and immunotherapy, if these studies are positive, they really start to move the needle in terms of what we should be doing to best treat our patients. Yeah, it's a great question. Obviously, the data from these research studies, as we discussed, can be practice changing, especially when these studies are positive. But beyond just the results of the abstracts that are being presented, the collaboration and the conversations that happen at the conference are really just invaluable. This is a chance for researchers from both industry and the academic settings, and even patients and patient advocates to really just come together and discuss ideas, to talk about, well, where's the field going? What are the next steps? How do we interpret some of the data that we're getting? And really, where is the field of GI cancers? Where is it going, and where are the areas of significant interest and opportunity? So I think that kind of conversation and collaboration is really key. And of course, when you walk through the poster sessions at conferences like ASCO, AACR, GI ASCO, it's really a chance to, number one, just see great data and great research that's being performed. But I see it as a really big opportunity to just get ideas, right? See what other people are doing. Hopefully that motivates other researchers to pursue their research interests, maybe with better ideas or armed with better data, and to really create what we're hoping will be the next generation of better therapeutics and better prevention for all GI malignancies.